She'd been eating on one side of her mouth for 3 years and had stopped mentioning it to anyone, including her dentist. I'm Emma, a medical concierge in Chengdu, China. Helen is 59, from Sydney. Advanced bone loss in her upper jaw and a failing partial denture she'd been repairing rather than replacing. The Sydney quote for a full-arch all-on-4 came to just over 28,000 Australian dollars, and she'd worked out that she'd need to sell something to cover it. She told me later that the hardest part wasn't the number. It was calculating how many more years she could reasonably wait. 7:50 a.m. Her flight lands at Chengdu Tianfu International Airport. 8:15 a.m. I meet her at arrivals, and we go straight to the hotel to drop bags. 9:30 a.m. Arrival at the dental clinic. Medical history and medication review completed. 10 a.m. CBCT scan of the upper and lower jaw. 10:45 a.m. Clinical examination and bone density assessment. 11:30 a.m. Treatment planning discussion. The surgeon walks her through the implant positioning on screen, and I translate the reasoning behind each placement rather than just the conclusion. 12:45 p.m. Impressions and digital scanning for the provisional bridge. 2:30 p.m. Surgical date confirmed for day 3. The full visit timeline mapped out to her flight home. By the end of her first day, she had the imaging, the assessment, the surgical plan, and a fixed schedule for a case she'd been postponing since her quote arrived in Sydney 3 years earlier. The Chengdu total came in under a third of it. If you want to understand how many days a full arch case actually takes on the ground, send me a message and I'll walk you through it. Day with Emma, medical concierge.